Good evening. The coronavirus has tested state government's 5-year-old pandemic response plan, but that plan also shows some of the areas the state did not anticipate dealing with. News 13's Chris McKee is here to explain.
Yeah, the pandemic influenza plan, here's what it looks like here. It does call for the closure of schools and businesses and the cancellation of mass gatherings, but that plan did not account for where New Mexico would turn if the feds weren't able to help with things like PPE and testing problems that the governor's team has talked about.
The biggest limiting factor for us is not our instruments or our personnel, it's the threatened supply of resources.
Just like the personal protective equipment, states are on their own to broker and figure out ways to get supplies in.
Now, the New Mexico pandemic influenza plan does not outline how the state actually gets PPE like N95 masks and gowns after, quote, preparation for a potential strategic national stockpile request. For testing, the influenza plan says test samples using kits provided by the CDC. Of course, neither of those things happened as planned with COVID-19, as the federal stockpile didn't fulfill all of New Mexico's PPE requests, and testing has happened largely through private partnerships. Now, this pandemic influenza plan was published 5 years ago under Governor Susana Martinez's administration. Other things not in that plan include locations for potential field hospitals, any robust plan for contact tracing, or where the state should get ventilators if need be. Those are all challenges the state has had to deal with during coronavirus.
This does not reflect by any stretch of the imagination, literally, the hundreds of orders and the effort that it takes by folks in state government and in the National Guard to work to get these supplies in. It is maddening, and it speaks to not having a federal strategy to do this.
Now, that 2015 plan, it also mentions the use of face masks as a public strategy to slow down the spread of the virus. It does not say, however, though, if those masks should be worn voluntarily or not. Back to you.
All right, Chris, thank you. We requested an interview with the health secretary about the plan multiple times over the past 2 weeks, but have been told that she is too busy.